So now we will go to assess the client's knowledge regarding to intrapartal care, and we are also going to assess the progress of labor of the mother, and we will also assess the infant once the baby is out, the color of the baby, and its airway, breathing, and circulation. And we are also going to assess the vital signs of the mother and the uterine contraction. And lastly, we will be able to assess the feeding cues of the infants. So by the end of this procedure, we will be able to assess the infants if she will be able to adapt in the outside world once the baby is out. And we will also assess the mother of any intrapartal complication and ensure that she is free from these complications. So good morning, ma'am. My name is Francis Allen Mercado, and I will be your student nurse for today. So today, ma'am, I'm going to assist you in your labor before, during, and after. So are you comfortable with your position, ma'am, or do you want me to adjust you? Okay, you're comfortable. Do you want to take a break, eat, or go to the bathroom, ma'am? Okay, you don't want to. Your current progress of labor, ma'am, you are now in your uterine contraction is now at 7 cm, so it's not fully dilated. So I will be here, ma'am, and I will going to assist you before and after or during your labor. Do you need anything, ma'am? Do you want me to assist you with? Okay. So hello, ma'am. Are you okay with that position? Okay, so this position is the default position or the semi-upright position in the delivery room. So we need to keep the room temperature within 25 degrees Celsius. All windows are closed, and we need to ensure the woman's privacy, and we need also to remove all the jewelry and any accessories like earrings, necklace, and bracelets, and we also going to wash our hands thoroughly and observing the WHO 1, 2, 3, 4, 5 procedure. And next, we are going to prepare a clean newborn resuscitation area, check the equipment if they are clean, functional, and within reach. And next, we are going to arrange all the materials and supplies in a linear sequence. So we have here the gloves, the dry linen, baby bonnet, oxytocin injection, instrument clamps, scissors, and 2 kidney basin. And in separate sequence, after the first breastfeeding, we have the eye ointment, stethoscope. This symbolizes physical exam. Next is the vitamin K, Hepa B, and BCG vaccines, plus the cotton balls and etc. And we have here the basin, kidney basin. And after preparing all the necessary equipments, we are now going to clean the perineum of the client using the antiseptic solution. But before that, we are going to wear gloves. So this glove protects us nurses from cross-contamination and any communicable diseases. So now let's proceed in cleaning the perineum of the patient. So ma'am, I'm now going to lift your drape and I'm going to clean your perineum area. Is it okay for you, ma'am? Okay. Okay, ma'am, we're done. And after cleaning the perineum, wash hand and put 2 gloves aseptically. And at the time of delivery, encourage the woman to push as desired. So ma'am, I need you to push. Okay, ma'am? 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. And while the baby is not is not already out, we are going to place a clean, dry linen over the mother's abdomen or the shoulder. This is in a preparation for the drying of the baby. Okay, ma'am, I need you to push. 1, 2, 3, push. And now I'm going to apply a perineal support. Okay, perineal support, and do control the delivery over the head. Okay, ma'am. Okay. So now, okay. Baby boy out, 12:30 a.m. So I'm going to carefully put the baby on the mother's abdomen in a prone position, and now I'm going to dry the newborn thoroughly. Okay. And stimulate the baby to breathe normally by minimize heat loss. Duration to 30 seconds, and during the first 30 seconds of the drying of the stimulation. Okay. So, do not over-suction unless mouth or nose are obstructed with secretion and other materials. And do not ventilate unless the baby is apneic and the baby is floppy. And do not rub off the vernix. And if the baby is not breathing, dry and stimulate after 30 seconds. And if the baby fails to breathe, suction, change gloves, and cut off the cord quickly and transfer to a firm, warm surface and start the newborn resuscitation. And next is the remove the wet cloth and check the breathing. Okay, now, so I'm going to remove the wet cloth. Okay. The breathing is normal. I don't see any abnormalities. After 1 to 3 minutes, position the newborn on the mother's abdomen and skin-to-skin contact. Okay. We're going now to position the baby on the mother's abdomen for the skin-skin contact. And I'm going to cover the back of the baby with a dry blanket. And if this is not possible, place the newborn in a warm and safe place close to the mother. And excluded the second baby by palpating the abdomen and preparation for giving the oxytocin. Okay, so now use a wet cloth and wipe the soiled gloves and give oxytocin within 1 minute of the baby's birth. Okay, now. So now I'm going to give oxytocin IM to the mother. Okay, and after that, remove the first set of gloves, and we are now going to clamp and cut out the cord. So I'm going to remove the first set of my gloves. And now we are going to clamp the cord of the baby. But before that, we are going to feel the palpation. Okay. After the palpation stop, clamp up to 5 cm from the base. Clamp from the base. After we put a clamp on the base, we are now put plastic clamp or tightly around the cord at around 2 cm from the baby's abdomen. Okay. Okay. We already put the clamp. And next, we are going to cut the cord between the thighs with a sterile instrument. Okay. So now we are going to cut the cord of the baby. Okay. So now, I'm going to put this inside the kidney basin. Okay, together with the scissor. And now, observe for, after we cut the cord of the baby, we are going now to observe for the oozing blood, and if blood oozes, place a second tie between the skin and first tie. And do not apply any substance to stump, and do not bind or bandage stump, and leave the stump uncovered. And after the first complete breastfeeding, we are now going to proceed for the eye care. We are now going to put an ointment in the inner and outer contour of the baby's eye. This is to protect the baby from any transmittable disease, just like gonorrhea. We are now going to wipe the eye of the infant. We're now going to wipe the eye of the infant from inner to outer canthus, and to the other side, inner to outer canthus. And next, we are now going to apply a antimicrobial after within hour of birth. So I'm going to put this. Okay. Okay. after applying the ointment from inner to outer cantos of both eyes, instilled at the lower conjunctival sac with 1 drop of tetracycline on both eyes. And next, for the injections, we are now going to administer a 0.1 cc of vitamin K at the upper outer quadrant or the vastus lateralis of the thigh. I'm going to clean the area. I'm going to administer the vitamin K. Okay. After administering the vitamin K, next is to administer the BCG vaccine IM. Okay. After administering the BCG, next to administer is the hepatitis B vaccine. Okay. And after administering all the vaccines, we are now going to take the anthropometric measurements of the baby. Starting from the length of the baby. Okay. We're now going to start from the length. Okay. And next, we're going to take the head circumference. Okay. And after that, next is to take the chest circumference of the baby. Okay. And lastly, take the abdominal circumference of the baby. Okay. And after taking all the anthropometric measurement, we are now going to weight of the newborn. So we need a weighing scale. So let's assume that this is a weighing scale. I'm going to weight first the cloth of the baby. Okay, so let's assume that we already taken the weight of the baby. And next, we are going to weight the baby. Okay. After taking the weight of the baby, we are now going to subtract the weight of the cloth from the total weight of the newborn. And next, we are going to get the footprints and the stamp it on the charts. And next is to assess the baby for any signs of illness and if chest is drawing or grunting. So I don't see any abnormalities. The baby's breathing is normal. And next is if baby is doing well, keep mother and baby in the skin-to-skin contact. Okay, so now I'm going to place the baby on the mother's abdomen. And for the delivery of the placenta, wait for a strong uterine contraction, then apply the contraction, continue until the placenta is delivered. And now we are going to massage the uterus until firm. Placenta is already out. Advise the mother to maintain skin-to-skin contact. Baby should be prone on the mother's chest or in between the breasts of the head, turned into one side. And inspect the lower vagina and perineum for laceration or tears and repaired laceration, tears if necessary. So, let's inspect. I don't see any lacerations. And after that, we are now going to examine the placenta for the completeness and abnormalities. Okay, I don't see any abnormalities. The placenta is all normal. And after that, clean the mother by flush perineum and apply perineal pad or napkin or cloth. Okay, ma'am, I'm going to lift your drape. Is it okay for you? Okay. Now I'm going to apply a napkin on your perineum area. Okay. And next, check and leave the newborn between the mother's breast in skin-to-skin contact. Okay, the baby is now in a skin-to-skin contact with the mother, and we are now going to assess the baby's color, breathing, and check the mother was comfortable or the uterus firm or contracted. Okay, now I'm going to check your uterus if it is contracted. Next, we are now going to dispose the placenta leak-proof container or plastic bag. And make sure to discard it in a proper way. And after you discard the placenta, decontaminate the instrument before cleaning, or decontaminated the second pair of gloves before disposal, stating that decontamination lasts for at least 10 minutes. Okay? From 15 to 10 minutes,
90 minutes.
advise the mother to observe for feeding cues and cite an example of the feeding cues. So every baby is different. At the rest period may take from a few minutes, 30 to 40 minutes. And before the baby shows signs of wanting to breastfeed, observe the newborn if shows feeding cues, just like opening of the mouth, tonguing, licking, and rooting. Do not give sugar, water, or any formula, and do not give bottle of pacifier, and do not throw away the colostrum. In the first hour, check the baby's breathing and color and check mother's vital signs, and massage the uterus every 15 minutes. So the baby's breathing is normal and the color of the baby is normal. And now we are going to check for the vital signs of the mother. And now we are going to provide a massage in the uterus for every 15 minutes. Okay. In the second hour, check the baby diet every 30 minutes to 1 hour and complete all the records.